My name is Chong, and this is assignment number 2, whereby the task is to demonstrate a functional prototype to support engagement, assessment, and feedback. Education has shifted from a teacher-centered model to a student-centered approach, where the lecturer acts as a facilitator. This shift enables more personalized learning but requires greater student motivation and interaction. Effective e-learning therefore depends on creative use of instructional techniques to deliver an engaging and motivating learning experience. We need to redefine the abbreviation E in e-learning as meaning more than electronic. It should encompass engagement through interaction, evaluation of learning through assessment, and definitely empowerment of learning through feedback. The selected topic is underbite or classroom malclusion. I will demonstrate the 3 key areas of engagement, assessment, and feedback in my LMS-based microlearning activity on this topic, which is targeted at Year 5 dental students. I hope you will enjoy it. Like for the topic number 11, underbite, the students will be able to see the learning outcomes that they need to achieve at the end of the activity. And to start off with the learning experience, we use the gain attention formula of the Getney's 9 events. As you can see, this is an 11-minute video whereby a patient showcased her journey of jaw surgery, and this would spark an interest with the students of the before and after treatment that they had underwent. Following that, they will go through an interactive question, which is an engagement part of the whole activity, so that they will think about what important questions they can ask if they encounter a patient with a class 3 malocclusion. So it will take them to a padlet activity whereby they can put on notes, sticky notes, and write what they feel. So for example, dental history, they could ask, how often do they see a dentist? And they can sign off their name as CJA, that's me. And they can have a look at others' students' input as well. For example, medical history, and a student have put any recent hospitalizations and any allergies. So this will have lots of social interaction online. If you have observed my e-learning activity, you can see that I have stated clearly the duration they are expected to take for each activity. So the main one would be the virtual dental clinic, which would take 20 minutes to complete. There will be interactive elements, formative assessments, and immediate feedback. And the aim of the activity is to describe principles of interceptive treatment, including timely intervention. So they just have to click it in, and they will get to the virtual dental clinic. So this
Doctor,
e-learning
please help
activity
my daughter.
has been done by the e-learning department, and it starts off with the case scenario. The student can have interactive elements such as clicking on the learning objectives, and then they can start.
Hi Mr. Tan. What brings you and your daughter here today?
Hi doctor. I noticed that she had.
Hi Stella, is there anything that you don't like about your teeth? Mr. Tan, does anyone in your family have similar features?
Yes. My wife had done a jaw surgery to correct her underbite previously. I do not.
So as you can see, it's a conversation between the doctor and the patient. So it stimulates lots of interest to the students, and there are also interactive elements where the students can click on and have a look at different kind of histories. So that would be good for them. Transitions into the extra oral examination. Interactive markers are added to the photographs, so learners can click and identify important findings themselves. This promotes observational learning and active discovery. In terms of Getney 9 events of instruction, This section provides learning guidance by demonstrating what important extraoral findings look like clinically. Similarly, the intraoral examination section uses intraoral photographs with clickable markers to highlight features such as interior crossbite and occlusal relationships. The next section introduced an important interactive decision-making question regarding whether the anterior crossbite is functional or skeletal in nature. The microlearning activity concludes with a positive treatment outcome where Stella and her father are happy with the improvement after growth modification therapy. Ending with a successful outcome reinforces the value of early interceptive orthodontic treatment and provides emotional closure to the story. In addition to the main learning sequence, I also incorporated self-check questions to assess performance to evaluate if learning objectives were met. Learners can test themselves independently and receive immediate corrective feedback, which supports assessment. Finally, further follow-up scenarios and questions are included to enhance retention and transfer, which is the final event of GATNI 9 events of instruction. Once the student has gone through the virtual dental clinic, which has many interactive elements as well as formative assessments and immediate feedback, they can go through another clinical scenario to apply the material they have learned. Then I would appreciate the feedback from the students so that we could further improve this material. And lastly, to have a reflection to support integration of knowledge. So this is done by e-Google form. There are clear instructions here telling them how long it would take for them to do. So the students will have a scenario and then they will answer it. And then they can also give their feedback, whether it was useful or not. And finally, they can type in what is their reflection of their learning, what did they learn, why is it important to learn, and how will they apply the knowledge gained into the clinic. In summary, the engagement features include group brainstorming through padlet activity, clickable pop-ups, and interactive questions to encourage active participation and maintain the learner's interest. Assessment features were also embedded throughout the virtual dental clinic using mandatory questions, alongside a Google Form activity designed to enhance retention and support the transfer of knowledge. Finally, feedback features such as automatic quiz feedback and the Google Form provided learners with opportunities to reflect on their understanding and identify areas for improvement. Overall, these combined elements aim to create an interactive, learner-centered educational experience that supports both knowledge development and clinical application. This prototype supports learning because it is student-centered, accessible, and engaging as it satisfies the Mayer's multimedia principles, which was highlighted in the first assignment. This virtual dental clinic was designed to be clear, comprehensive, and constructive by integrating engagement, assessment, and feedback features throughout the learning experience. However, potential future improvements are to make the voiceovers less robotic and to gamify the experience by providing points and ranking. In conclusion, this prototype applied the GATNI's 9 events of instruction by providing a video to gain attention of students. The learning outcomes were also provided to inform learners of the objectives. An interactive padlet activity stimulate recall. The virtual dental clinic presents content progressively. Guidance is also provided through narration and pop-ups. The performance is elicited through quizzes, and feedback is immediately provided. Self-check activities also assesses performance. Finally, retention and transfer are enhanced through the Google Form activity. By integrating engagement, assessment, and feedback, this microlearning activity aims to promote effective learning experience. Thank you very much for your attention.